morning. Welcome to MagnaWave office hours for this Tuesday morning. I'm here every Tuesday morning, 9 o'clock Eastern time, to answer questions, whatever questions folks may have with regard to MagnaWave, machines, training, PEMF in general, anything that it may be. So welcome aboard this morning. I'm glad you're here. If you have any questions, good morning, Maureen. If you have any questions, please put them up there. Be so kind as to share this with your friends, so perhaps if they have questions, they can get them answered as well. It's a great way to share this in your local community, because these people are potentially your customers, and be good for them to see the interaction and be able to ask questions of their own. So please do that. Hey, good morning, Aaron. So again, we're here to answer any questions that you may have. All right, a couple of things. I received a question last night. Someone was talking about Gauss and the differences between the Gauss on the various machines and what's on the website with regard to the Gauss. And I'll quickly cover that issue one more time. When these machines, when our factory, which was probably the first factory in the country to be building high-powered machines going back some 20 years, 25 years, the engineer that built these devices based his Gauss delivery on a mathematical equation. If I had this type of capacitor and these type of resistors and these types of diodes, and I had the power coming in at this source, what would my Gauss be? And it came out to, the calculation came out to 1.9 Gauss, and that's kind of the configuration he was using to build his machines. And so everyone from that point on has been saying this is the Gauss delivery of our devices. And the problem with that is there was really no accurate way of measuring the Gauss delivery at that point in time. Normal magnetometers are designed to read constant signals, which would be an oscillating type of signal that would just go and not stop. And so that's what a normal magnetometer reads, something that is continual. With our devices, with high voltage, low frequency devices, the signal goes up, it comes down, and stops, meaning it goes off. And a magnetometer gets confused when it sees that and really doesn't know what to give back as a true reading, and so they're all over the board. So consequently, there was a lot of different conversations as to what the Gauss was. But they were saying, well, this device and most of these devices, and the competition does the same, and say, well, they are 1.5, 1.9. Now people are saying they're 2, 3 Tesla, 4 Tesla, so on and so forth. And again, most of them don't have any way of accurately measuring these devices. The other thing that happens, and that no one has ever really talked about, is the attachment is directly proportional to the Gauss or the Tesla that is delivered. An attachment that is quite large, like the large loop, or in our case the wave wings that are 24 inches in diameter, it greatly changes the amount of Gauss that is delivered to the area. However, it's stimulating a very large portion of tissue, and so on an animal like a horse, you see a lot of movement at a very low setting because we're putting a lot of energy, but yet less energy because of the size of the hoop. So it really becomes confusing when people talk about it. But in fact, the larger loops provide less Gauss, but they're stimulating more tissue to give a good tissue, deep tissue type of massage to the body, whereas the large loop or the butterfly loop or the paddle is stimulating smaller areas of tissue, so you don't see it as much. But the paddle, for example, will just about double the intensity or the amount of Gauss being delivered to an area. And so 3 or 4 years ago, we had a device made, manufactured here in the United States by people that build meters and measuring devices specifically to read our type of equipment. And so they built these devices. The factory has one, I have one, a few other people have one, and what we learned is that what we figured mathematically several years ago was not the case in reality, and the numbers were different. The numbers were lower. And so going back 3 or 4 years ago again, I began saying, well, here's the real numbers and here's what they are. And of course what happened, my competition started saying, see, they don't have any power, or they don't have this, or they don't have that. So we just said, okay, we're just leave well enough alone if that's what everybody's going to say and use it instead of them going out and measuring their devices. And you'll see that today. People will say, well, my machine's 4 Tesla, or my machine is 3 times more powerful than somebody else's machine, but then you ask them for delivery and they'll say, well, we really don't have any way of measuring that. And so it gets very, very confusing. And we even talked about it when we talk about the semi with delivery. And what people will do, and it's true, when we measure our devices, if people want to know the peak output of the devices, we'll use the paddle. And we'll measure on the paddle to see what's delivered. And so the specific question came up is, what about the semi for FEI use, or for the use? Well, when you use the paddle on the semi, you can very easily, in real numbers, get up to 3,000 Gauss of delivery. And if you go down to the butterfly loop, it's different. It's less than 1,000 Gauss. The large loop is also less than 1,000 Gauss, and the wave wings are quite a bit less than 1,000 Gauss. But the job that they do with the tissue that's stimulated is incredible. So it's just easier today in many cases. We'd love to see uniformity in the industry to where we have testing devices and everybody tests and everybody's on the same playing field. But until that happens, it's all over the board, to be very honest, and it is all over the board. And but we try to present it with that type of situation. So that was the question that was specifically asked. So we use the paddle to measure and for the highest output of the device, and then we can look at what the other attachments provide as far as Gauss delivery. But what I prefer to do when I'm talking to people about that, it's all about energy. We're putting a magnetic field into the body, and we want to put as much energy in the body as we can comfortably. We want to stimulate, supplement the injury to but the energy to the body to provide good supplementation of energy to the body so the body can heal, better take on oxygen. You know the drill, things that I've always talked about in the past. So it's just easier to talk about how much energy we're putting in. And when you look at that, you can take these devices, and rarely does someone take the most high-power devices and turn them up all the way. Well, if they're treating an ankle or a foot or a knee or elbow or whatever, they may turn the machine up very high because they want to really get to the area quickly and do the work on it. And so, but when you get down to it, it's whatever is comfortable. It's there. Do you have to get it to where it's on the edge of comfort? No, you can use it less, but you have a machine that's designed to distribute or to put more power into the area to more rapidly reduce the inflammation, which will take away pain and allow the body to be set up to better heal itself. So I just wanted to kind of cover that a little bit. You could talk about it in energy, and of course, you know, it's all over the board. Some companies talk about hertz delivery, and they talk about setting it to a specific setting of hertz, and what they're just trying to modulate and create a area for what they're selling, and that's fine. I mean, you can describe what you're doing in many different ways, but we are not a hertz-driven machine. We are hertz-powered. And so there's where it gets confusing, and we can talk about this all day. And if you have questions about that, I'll try to explain it to you further. So we have a question. I'll bring it up here and take a look. Maureen asks, recently I spoke about the semi and how it runs at 2 different levels simultaneous. Could you explain that a bit? Great question, Maureen, and that question was actually requested yesterday as well. So what the semi does is it does deliver 2 signals at the same time, and we have a little device that you can hear the lower signal that's being delivered. So when you turn it on and you put this little device on it, you'll hear a very fast click, 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 signal that's going on in the background all the time when the semi is being used. And then there is the higher intensity signal that is the click, 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 that is being delivered, and there's 3 power levels of that clicking signal that's being delivered, low, medium, and high, which is exclusive to the MagnaWave semi device. And so the background, and it's interesting, and so here was the logic from the engineering aspect, is that by Dr. Dennis, when he performed the NASA study, he found that he got very good healing properties and healing capabilities with the lower signal. he felt that the higher power signal, which he's expressed on our webinars and when I've talked with him and which he shared this year at our MagnaCon, was that the higher power signals are more rapid to reduce inflammation, take away pain, make the patient more comfortable. They do set the body up to better heal itself more rapidly, whether it's an animal or a human. And then his logic was that with the lower signal in the background, if you can use a lower signal, you may get a little better or a little faster healing. Enough to where it makes a lot of difference, not necessarily so, but enough that that he felt that it did make a difference. So when we designed the semi, the whole logic became, let's put the low underlying signal there at the beginning and have it there all the time. Then let's use the high intensity signal to help relieve inflammation and to relieve pain quickly. And so that's the logic between the two signals of the semi. And I really think that that's one of the reasons that the semi is so effective, is that from the get-go, it's reaching all spectrums of the signal delivery and making it more viable potentially to the healing process. Certainly with the Max machine, you can use it, or the Pulse Pro machine, or even the Maya digital machine. You can use it, turn it up a little bit to where it's comfortable, get rid of the inflammation and the pain rapidly. And if you want to turn it down to a lower signal and let it run for a period of time just to stimulate at a lower signal, that would be great. I've often maintained where people talk about complementary methods of use. And in fact, we have the MagnaWave LP machine, the low power machine, which is a constant low signal. And the challenge that we've had with machine, we put the MagnaWave name on it, and people think, oh, it's the same power as the big machines, and it's not. It's designed to be low power. And I've often maintained with folks that if you use the MagnaWave, if let's say you have a damage to your knee, when I messed up my MCL, I treated myself twice a day with the Max machine at a comfortable level, as high as I could comfortably use it, and then through the day I would wear a low power machine on my knee just to keep things in check, keep them at bay, and then I'd come back and treat it again. So there's many different ways, and you could do the same thing with other complementary therapies to help enhance what you're doing. Complementary is wonderful when it comes to the utilization of these devices. So that's the way the semi works. It's got a low power signal that's there all the time, and then it's got the high power signal that is intermittent with it to help keep the inflammation or fight the inflammation and pain relief at the same time. So I hope that helps, Maureen, and great question, and that's where we're looking to go as we continue to develop devices down the road. Let's see, let's pull this question up from Suzanne. Good morning. Does this help with navicular horses? Great question, Suzanne, and the answer is yes. And I found years ago when I first started and I was out in the field treating regularly day in and day out, that a lot of people would talk about navicular. And the issue became, our question became, is there actual degradation of the bone to where the bone is degrading and falling apart, or however you want to say that, or is this a situation where the bursa around the navicular has become inflamed for some reason and is causing the pain in the area, which is thought to be navicular? Certainly, when you're dealing with navicular, it's about pain. So there is inflammation in the area, and we want to get rid of the inflammation and let the area feel better and be able to go. So if it's bursa, the sac around the navicular, then we can work to relieve the inflammation there. If there's nothing going on with the bone, then maybe we can relieve the situation, whatever caused it, and it won't come back unless that same situation is exhibited again, or the same cause is exhibited to the animal again, and then all of a sudden, bingo, you have inflammation. If the degradation is there, then it's going to begin. It's like a spur. You can take care of the pain, get rid of the inflammation, and they feel better, but the degradation is there, making it irregular, so which impacts the bursa, which impacts the connective tissue in the area. Bingo, you have inflammation, which results in pain, which results in performance change and comfort of the horse, or lameness, however you want to look at it at that point. However, if you have a degradation situation, two things can be improved. With improved blood flow and improved oxygenation and improved circulation, is that you can hold it at bay. you can maybe slow down the degradation. It's kind of like arthritis. If you have buildup of calcium, if we treat, we're not going to get rid of the calcium that's there. That's not what our machine does, but it keeps the inflammation down in that area, and the improved blood flow can maybe slow down the buildup of calcium that goes on to lead to the pain and inflammation or arthritis as it may be described. So certainly in a situation of navicular, the application of the device can be very helpful to relieve the inflammation. You need to certainly be with your veterinarian about, is it bone degradation or is it inflammation of the area or the bursa around the bone. But again, kind of being very basic, any issue, most issues that deal with pain in the body are a result of inflammation. And we are basically an inflammation reduction device that sets the body up to better heal itself. We don't really heal anything. We just set things up to heal and to better use the nutrients or the medications that are being applied to do that. In the case of surgery or replacement of hips and knees and things like that, we want to speed up the healing process after everything has taken place. So I hope that helps with that question. And navicular. Let me come back and see what Maureen. So many of my horses respond beautifully to the semi. They love it. Well, thanks, Maureen, for sharing that. That's an unpaid endorsement. And I didn't request that Maureen say that. So if you have any other questions, put them up there, and I'd be happy to answer them. I did receive a question. The question was, on a pregnant mare that's still competing, can we, on their legs, can we use it on their lower limbs? What is safer, injections or MagnaWave? Well, I'm going to say that most any doctor, veterinarian, contraindicates a lot of things when it comes to pregnancy in mares and so on and so forth. So certainly anything you do, you want to clear with the doctor. What is safer, injections or MagnaWave? I think without question MagnaWave is safer than injections. I'm not taking anything away from the injections, but I remember veterinarians or people used to talk, you can only inject so many times, and what if you hit something that you don't want to hit? And I'm not saying that happens, but that is a risk anytime you stick this needle into the area. So what is safer, a non-invasive method to approach the inflammation reduction as desired, or whatever it may be. Now, so the question comes down to, we don't certainly, from a logical situation, want to treat or be around pregnant mares, because things move. There is vacillation of the tissue, so we certainly don't want to treat. We don't want to move the foal or the fetus at a time that it doesn't need to be moved. We want to keep it stable. And we've had many cases over the years where there's pregnant mares and they're saying, well, we can't treat them, and all of a sudden the mare is going to founder or going to have terrible problems. And so we say, well, the vet says, well, treat. Let's keep it on its feet. Let's keep it healthy. We don't want to lose the mare and the foal, that or the baby, that whole thing. So you have to use common sense. I would certainly check with my veterinarian and see what we're doing. And if you're still competing, there may, someone would say, well, maybe you don't need to be competing. But that's also telling me that it's very early in the process of the pregnancy. But to treat from a logical thought, to treat the knees and the ankles and the upper part of the hip on the back or the shoulders, there should be there's nothing in the signal that is going to damage the fetus. There's nothing in the signal that's going to damage the area other than movement, and we don't want to be around an area of movement. So check with your veterinarian and look into it and discuss it with them, and always certainly follow their lead. But there's really nothing that we're doing that's going to harm anything if you're treating a foot or an ankle or a knee to treat the lower limbs of an animal that is still competing. Great question. So that I think that's, you just have to think about those things and go on. Then I did receive a question, wondering if it would harm my machine if it had to be left in a hot vehicle for a couple hours in this Texas heat. No, there's really nothing. There's no damage that's going to occur to your machine if you leave it in a hot car. But you do want to think if you got a car you're in Texas or you're somewhere where it's hot. It's hot everywhere right now. But you put it in a car, and if it's 90 degrees outside, it might be 120, 130 degrees in the car. Certainly when you take your machine out and you go to plug it in, turn the fan on, let it run for a little bit so it cools itself off, because the machines are designed that if they get too hot, they will shut down. They're designed that if they are in an overheated type of situation, they will shut down. The machines get up to 160, 180 degrees on the inside of that machine at certain spots. And so you have that type of situation. And so if you take it out of the car and you plug it in and you go to start treating, and it's trying to go and it's already very close to the maximum that it can handle, it may overheat and shut off. Well, then the same thing. Just let it run for a while. Let the fan run for 2 or 3 minutes, and I would recommend in those same types of conditions that between treatments, when you're finished with the treatment, let it run for 30 seconds, 45 seconds before you move on to the next treatment. And to that end, there have been some people that have said, well, the MagnaWave devices are designed at the end of a 20 or 30 minute treatment that they need to sit and run for 10 minutes before they're redone, and that's a problem. And that's not the problem. It's never been described as how these machines are required to operate. You do want to let any machine get a chance to recycle a bit between sessions, but there's no rule or nothing in our devices or in our literature that says at the end of a 10-minute treatment or a 15-minute treatment it has to sit for 5 minutes and cool off. But it is always good to let airflow be good and to keep your machine in good shape. So, any other questions? I'd be happy to answer them for you. Let me see. Let me take a look here in my places where I've had the questions. Here's a question. Boyfriend's 90-year-old grandma just broke her hip. She's having surgery on it tomorrow. She fell about 4 months ago and scratched her leg pretty badly, and it still hasn't healed. So her body is not healing itself well at all. The family is nervous because they are worried that the MagnaWave might hurt something because her bones are so brittle and her body isn't healing. Would it be okay to have sessions with her? I know at least a week or two after surgery to let the bones start healing from the inside. 2 or 3 very good questions there. Basically, the MagnaWave, by virtually applying it to the body, will enhance the entire blood oxygenation and blood flow to the body, which could be very beneficial to help this area heal. The MagnaWave's not going to do anything to hurt a bone or to just by virtue of the pulsing cause it to have an issue with the bone. If they're going to do surgery, they're going to do a lot more invasive stuff to the body than what MagnaWave is going to do in providing a treatment. So my answer would be I'd put the coil over the area of the scratch and put it on a very comfortable setting for the lady and let it get a chance to help the wound heal. We've seen countless testimonials and countless photographs on the MagnaWave Facebook page where you see how it speeds up the healing process and closing of the wound, again with good oxygenation and good blood flow to the area. So I would certainly recommend that and pursue that as a course of action, certainly with doctor's clearance. The question, and this is, there's a difference between human and animals. When you talk about horses, we have always maintained that if there's a fracture or an issue with a broken bone in the horse, you want to wait a couple of weeks so as it begins to heal from the inside out that you begin to treat. You can still go back and accurately form an x-ray and see what's going on. What they discovered early on with PEMF and these types of devices is that if you start treating right away and then you go back and x-ray in a few weeks, it's going to look pretty good, but yet it's not totally healed all the way through. And so we've always maintained, wait 14 days, let it begin to heal from the inside, so when you then start to work and it comes out and they go to radiograph, they're going to see that, oh, it's almost clear. And this is where it's at as far as the healing process. So that's why we wait that length of time, because there are situations they take well, gee, it's healed, let's go, and it's not healed all the way. And so we wait and then go after it, so when it's checked, we know that it's in a better case. With a person, you can tell when it's still hurting, or you know what's going on. So when a broken bone on a person and you go to work on it after surgery or after something's taken place, you can work on it very quickly. You can get started right away because they're going to work it more. There's interaction, there's conversation back and forth, and when they do the x-ray and the whole 9 yards after the time of healing. It's a good safety situation, or a good situation if you want to wait 7 or 8 days, let things set up, and then go. That's fine. You're still going to speed the healing process by a third or more. So that's how you want to approach that. So there's a couple of good thoughts there in that question. Good morning, Karen. Any other questions, folks? If you have them, please post them. If you'd like to give me a call, you can do that. If you have something that you would like to discuss, let me put that up here. Just simply call 502-599-9722. Mute your speakers, or you can Skype me at pzemer, and you can come join me. If you have Skype on your phone and you wanted to come on and visit and join me, we can do that as well. So 502-599-9722 to get your questions answered, or to have a conversation if you'd like to do that. If there's something to discuss. There's certainly a lot of questions going on about FEI and all that type of stuff, but has anyone treated clogged lanolin ducts in baby sheep? It's about 5 days old and seems to have an infection in 2 front feet from the clogged ducts. Well, it's kind of like Elaine has shared when you're talking in totally different situations, but the ducts are clogged. Circulation to the area will help that. The pulsation to the area may help move the area and help things unclog. So I would think most certainly that it could be beneficial to approach that. Again, good oxygenation, good blood flow, that'll enhance any area that we're potentially dealing with in those types of situation as you're dealing with it. So, any other questions? Throw them up there. We've been here about a half hour now, so I'd be happy to answer the questions that you may have. I don't want to just sit here and talk. That's not always any fun, but I do want to help and answer any questions that you may have. There's a question here. This was interesting. It came up. People were talking about that working on a horse today, and someone from another state said that you always have to, every problem in a horse is tied to the heels bulb area of the rear feet, and it was in the training that every horse needs to get done in that fashion every time. And there's a lot of ways horses can, or people or small animals can have injury or issues. It's not always coming from the feet. Now, if someone is a reflexologist and that's how they work on situations, then you work with stuff. And I do in our training, I do have areas where we're talking about treating this area for where the treating this area where the sensitivity may be, and perhaps you want to treat this acupuncture point in relation to that, because a lot of people like to make that correlation between acupuncture points and other areas of the body. And clearly, there's nothing in our training that says you have to treat the feet, the back feet, when every treatment of the horse, and that every problem comes from that. We don't make any claims about where problems come from and how they start. And one of our practitioners also responded to that particular question, of Farrier and Jason, that's not the case, and that it is not part of the training. But it was a good question, and it's funny how people get into specific thoughts about how things work and what needs to happen every time, and that's not the case. Every person is different, every small animal is different, so how you work with this dog compared to that dog is going to be an issue, or how you deal with my sore back and someone else's sore back, because we're not the same. Different weight distribution, different athletic endeavors or involvement with exercise, and what people do certainly impacts what's going on with them and how they need to be treated as they go along. So I don't see any other questions coming in from the folks joining us or with us today. I certainly appreciate you being here with us and look forward to being back next Tuesday as well. So I want to thank you for being here with me this morning, and we'll be back, and we thank you again. And I did redo. Someone told me that my outro was a little loud, so I have changed it. If it's still too loud, let me know. But thanks for being here. Wave on. Have a great day. And remember, we're here to answer your questions, whatever they may be. Give us a call at the office or come to this program on Tuesdays. Have a good day. Bye-bye.